So in this paper, this represents a collaboration between adult and pediatric rheumatology in Canada to talk about an important issue, which is around improving transition care for youth with rheumatic diseases who are going over to the adult rheumatology side for their ongoing care and monitoring. And what we've heard in the past work as we were considering different groups that face inequities in rheumatology care is that that period of transition to adult rheumatology service is particularly difficult. Many people are actually lost to follow up, which then results in things such as disease flares, presentation to emergency departments, having to be hospitalized, or having treatment increased because there's been gaps in that ongoing follow-up. We also heard that the adult rheumatology care system is very, very different than what youth had experienced in their pediatric days. And it's also a particular difficult time because youth are gaining independence from their parents as well. And all of this puts together as a bit of a perfect storm for really causing disease to flare and not be well adequately managed. And so what we wanted to do was to decide what we could do nationally to try to improve that transition care. In this, we took several approaches. The first was to do a survey of Canadian Rheumatology Association members to ask about how many were busy providing transition care. What did that care look like? Who was really doing the bulk of the work? Did it require extra personnel in their offices to support that? We also asked the rheumatologists about how well prepared they were for providing transition care to patients. We also went around and spoke with people from different cities where there were transition care models in place and understood what was their process, how did that work, and who was really critical in their teams to do that. So what we learned from that survey was that many pediatric rheumatologists are familiar with the transition care process and the elements of it, but adult rheumatologists really aren't. It's not something that they're exposed to in their training programs in a systematic way. Also, many adult rheumatologists are completely unaware that there are transition initiatives in Canada for general concerns, but also specific guidelines from EULAR and PRESS, which help to guide what aspects should be covered in that transition process. We also heard that many rheumatologists, so up to 3/4, don't actually have appropriate resources to support transition in their practices. So it's really ad hoc. And then in our work around what were the barriers to care or the things that people had noticed, certainly lack of communication in that transition process, the lack of coordination between all the different providers that that patient is transitioning to, as well as the availability of knowledge and personnel resources to adequately support transition care were main problems. We also heard about some models that were fantastic. So there was really a true shared care model between adult and pediatric rheumatology, a very well-defined process for ensuring that patients were transitioned and ready to transition. We saw some models where there's a stepwise approach and there's some link between pediatric and adult rheumatology care in that transition process. But it looks very different and is resourced in different ways in different places. And then finally, some places where there just is not allied health availability to support that transition process. So it really is a direct transfer. So one day you're a pediatric rheumatology patient, the next day you're an adult rheumatology patient, and there's really no specific supports. So from there, we went and did a national process where we sought feedback on where we invest our efforts in the Canadian Rheumatology Association to really support better transition, and did a consensus process to understand what we invest our efforts in. And the most important aspect was for us to support that patient and family education in that transition process over to the adult services. So that could be understanding the healthcare system, learning how to navigate it, knowing what is available, what is not available. We need to do a much better job of working with patient organizations that have that mandate as well to support education, but doing it in a way that's coordinated with everybody together. The second aspect was to make sure that we were able to ensure access to allied health professionals who are absolutely critical in that transition process. They serve as a great bridge between patients and providers, between pediatrics and adult rheumatology care. And we need to find a way that they can be supported in their roles, both from a finance perspective as well as an educational perspective. There were then a whole host of other things that were important that we will also continue to work on, which includes provider education. So we need to ensure that the adult rheumatologists learn about transition and the developing brain, and also how to better support and work with families as they, again, are going through the process of their youth, gaining independence from their families. So these are all activities that we'll continue to pursue as a collaborative across the country, and so that we ultimately improve transition outcomes in Canada.